You will have several options to document your exam information in your chart note. The information at your disposal will vary depending on specialty. However, the method in which you enter the text will be the same from one standard template to another. You will mainly see checklists and links in the exam section of your template, and these are the tools that will change depending on specialty. Before I show you that functionality, I wanted to remind you that you always have the option to type or dictate your exam information if that is what you prefer. If you plan to do so, just place your cursor in the note where you want the text to go and start typing or dictating. Please keep in mind, though, that if you choose this method, you will not be able to use the carry forward shortcut functionality in a follow-up note. That functionality is only available if you use a checklist to enter your information. We are looking at the standard template for internal medicine, so please keep in mind that if you practice in a different specialty, your exam options will be slightly different. All of our standard templates have a checklist directly in the template, like we are seeing here with short exam. The short exam is meant as a quick way to get basic exam information in your note. It will not go into great detail about a specific system, but be more of a general overview. Short exam is a really good tool if the patient's exam is generally normal, because you can use the All Normals icon from outside of the checklist to document this quickly. By clicking the N icon, you will instantly receive the normal statement for each system in your chart note. If you need to modify a statement or delete a statement because you didn't cover that system, click the Open icon to access the checklist. Notice that when you use the All Normals functionality, all the minus signs will be green. This indicates you selected the normal statement for that system. Also notice that you can access the All Normals functionality from within the checklist as well. If you did not address a particular system with this patient and want that statement removed from your chart note, click the green minus sign to remove it. If you want to edit one of the selected statements, right-click on the system description from the top, and then select Edit. This will open a free text dialog allowing you to modify the text. The changes that you make by editing a statement will only be displayed in this note. Editing a statement is not modifying the defaulted text for a template. To document abnormalities for a system, click the plus sign associated with it. In most cases, this will then prompt you to select from one of two statement options. The one you select is completely up to your preference, and the only difference between them is that the second option will allow you to free text your findings, whereas the first statement will allow you to select from a pre-configured list. Click the desired statement so that you see a black box appear to the left of it, and then click OK, which is located on the right side of the pop-up. This will display a follow-up dialog in which you have the chance to click off symptoms that you have observed. This is a multi-select field, so click as many as are appropriate. If you don't see the option you are looking for, don't worry. You will always have the ability to right-click and edit the statement like I showed you earlier. If you would like to free text or dictate more information, use the free text box at the bottom to do so. The text entered in the free text box will show as a separate paragraph when printed. Click OK when you are done documenting exam information, and you will see your text populate the chart note. Beyond the short exam, you will also find other exam-related checklists available through the Detailed Exams link located right below the short exam. When you click on the link, you will see a list of other templates specific to each system that may be incorporated into this chart note. When you click a particular link, it will bring the contents into your note. Typically, these are individual checklists that will allow you to document greater detail than the short exam allowed. When I open one of these checklists, you will see there are many more clickable options available versus when I viewed the same system through the short exam. You can click off as little or as much as you need to properly document your findings for this patient's exam. You may also free text in the bottom box if necessary. If the checklist has a Quick Normals option, this is a shortcut to quickly get the normal statement in your note for this system. The quote-unquote normal statement that is selected will always be the first option configured in the checklist. Click OK when you are finished documenting this information. Take note that you could have also accessed the All Normals option from outside of the checklist. Many times, users will decide to utilize the short exam for their normal findings and the detailed exam links to document abnormalities due to the fact that you may want to go into more detail with the abnormal findings. If you are using a mixture of the short exam and detailed exam links, make sure you are not contradicting yourself or have duplicate information documented in both areas. Upon follow-up, if the patient's exam information hasn't changed since their last visit, click the blue arrow located in the checklist menu bar to carry this information forward. When you do so, you will be presented with a dialog listing the most recent chart notes to select from. Select the note in which you would like to pull the exam information from, and then click OK. The text from the previous note, including any free text entered within the checklist, will then output in your current note. If you need to modify any of this text, click the Open icon to do so. Then follow the steps we discussed earlier on how to modify an individual statement. If you did not select the Carry Forward option prior to opening this dialog, you will have the option to do so within the dialog by clicking Carry Forward from the top. Or if you would simply just like to start from scratch, you could click Clear All to remove all pre-existing text and start over. Please keep in mind that the Carry Forward option is per checklist, so if you utilize the short exam and a detailed exam link in a previous note, you would need to click Carry Forward on both to have a comprehensive exam in this follow-up note.